Hello, and welcome to the Alice Care training module called Non-Medical Care Only. This training highlights the difference between non-medical care, approved services, and medical care. These rules apply to every caregiver on every shift, with every client in every setting. Today, you will learn one rule that protects the client, protects your job, and keeps Alice Care compliant with CDSS requirements. Here is the rule. You provide non-medical care only. You never perform medical tasks. In this training, I will explain what CDSS allows you to do, what CDSS does not allow you to do, what to say when someone asks for a medical task, how to escalate the request, how to document it, and what disciplinary actions apply when someone breaks the rule. This slide gives you the only rule you must remember. You provide non-medical care only. You never perform medical tasks. CDSS defines home care services as non-medical services and non-medical assistance. CDSS states that home care organizations do not arrange medical services. CDSS states that registered home care aides do not provide medical services. CDSS does not grant waivers or authorizations that allow medical services through a home care organization. That means consent from a client does not change the rule. A request from a family member does not change the rule. Extra pay does not change the rule. Pressure does not change the rule. Your prior experience, certifications, or training do not change the rule. When you feel doubt, you stop and you contact Alice Care for guidance before you act. What may you do? CDSS describes many examples of non-medical home care services. You can help with activities of daily living, like bathing, dressing, transferring, and ambulating. You can help a client move safely from bed to chair. You can support safe walking. You can support feeding and safe positioning during meals. You can help with toileting and incontinence care. You can support personal hygiene and grooming. You can also do supportive tasks like meal planning and meal preparation, housekeeping, laundry, companionship, transportation, and shopping. You can also help with telephone calls and basic correspondence. When a request falls outside these categories, treat the request as medical until Alice Care confirms it as non-medical. Medication support creates confusion, so we make this very clear. You may help only when the client self-administers medication. Self-administer means the client controls the medication and takes it themselves. You can provide simple support that does not become administration. Allowed support includes opening a bottle, canister, or blister pack. Allowed support includes reminding the client to take medication. Allowed support includes reminding the client to refill medication. You must not administer medication. You must not decide dosage or timing. You must not inject anything. You must not place drops in eyes or ears. You must not crush pills or split tablets. You must not mix medication into food or drink to deliver medication. You must not apply topical medications. If the client cannot self-administer, you must refuse the request and you must notify Alice Care right away. Alice Care will help the client contact the appropriate licensed provider or the right family contact. If you feel unsure about any medication-related task, stop and contact your care coach or supervisor immediately. Now we name the tasks you must never do. You must refuse insulin shots. You must refuse catheter care. You must refuse wound care, bed sore care, and post-surgery wound care. You must refuse physical therapy or rehab exercises as treatment. You must refuse blood glucose checks. You must refuse tube feeding and tube care. You must refuse to perform enemas. You must refuse IV insertion and IV-related care. You must refuse monitoring or recording blood pressure. You must refuse monitoring or recording vital signs. You must refuse ventilator-dependent care. You must refuse colostomy bag care. You must refuse medication administration. This list does not cover everything. When you feel unsure, treat the task as medical and contact Alice Care. Do not guess. Guessing creates risk for the client and risk for you. You do not debate. You do not negotiate. You do not do it just once. You refuse, you escalate to Alice Care, and you document the request. Even if the client is your own family member, you still follow the same rule during an Alice Care shift. During an Alice Care shift, you do not perform medical care activities for any client, including a relative. If a family situation requires medical help, contact the appropriate licensed provider, nurse, or emergency services, and notify Alice Care. Do not perform medical tasks. Refuse the request, escalate immediately, and document what happened. You will face medical requests, so you need a simple, repeatable response. Use 4 steps. Step 1. Refuse clearly and calmly. Say, "I cannot do that. CDSS rules allow me to provide non-medical care only." Step 2. Offer a safe alternative that stays within non-medical care. You can help the client get comfortable. You can bring supplies. You can call a nurse, a family contact, or emergency support when needed. Step 3. Escalate immediately to Alice Care, using the on-call process or your supervisor. Step 4. Document the request. Write the date, the time, what they asked, what you said, and who you notified. This 4-step response keeps your actions consistent and keeps everyone safer. Now we practice 3 scenarios you will likely face. Scenario A. A client asks you to check blood pressure and write it down. Treat this as a medical request. You refuse. You say the script. You offer a safe alternative, like calling a nurse or a family contact. Then you notify Alice Care and you document the request. Scenario B. A family member asks you to give pills because the client forgets. You can remind the client. You can open the bottle or blister pack when the client self-administers. You cannot administer medication. If the family insists that you must give the pills, you refuse, you escalate, and you document. Scenario C. A client asks for an insulin shot because they cannot see well. Insulin shots are medical services. You refuse and you escalate immediately. Practice these scenarios out loud so your words come out calm and clear under pressure. Disciplinary actions. Alice Care enforces the non-medical rule because it protects client safety and keeps the company compliant. Certain actions trigger discipline. If you perform a medical task, you trigger discipline. If you agree to perform a medical task later, you trigger discipline. If you ask another caregiver to perform a medical task, you trigger discipline. If you fail to report a medical request, you trigger discipline. If you falsify documentation, you trigger discipline. If you ignore escalation instructions, you trigger discipline. Alice Care may use progressive discipline when the situation allows. Alice Care may also move directly to termination when the situation creates serious client safety risk, serious compliance risk, or repeated behavior. Possible actions include coaching and retraining with a retest, written warnings, removal from shifts during review, suspension pending investigation, and immediate termination. Alice Care may also report certain violations to authorities when the law requires it. I also need you to understand a final risk. A medical task can lead to an incident, a complaint, or an investigation. CDSS or other authorities can get involved. When authorities get involved, consequences can extend beyond Alice Care. CDSS can suspend or permanently revoke your home care aid registration. If that happens, you can lose the ability to work for Alice Care. You can also lose the ability to work for any other home care organization. Regulatory records can impact your future employment in caregiving. This is why the safest choice stays the same every time. Do not perform medical tasks. Refuse the request, escalate immediately, and document what happened. We will close with one script you can use in almost every situation. Say, "I am not authorized to do that. I provide non-medical care only. I can help you get comfortable and call your nurse or family contact. This script keeps your response calm, clear, and consistent. Remember these 5 actions. You provide non-medical care only. You stop when you feel unsure. You refuse medical tasks. You escalate immediately to Alice Care. You document every request with date, time, and details. When the client needs medical help, you support them by contacting the right licensed professionals and the right family contacts. You do not perform medical care yourself. Thank you for completing the authorized care training. Next, complete the quick quiz, then log in to Paychecks if you have not done so already, and sign the non-medical care acknowledgement. On this training page, you will also find helpful links to CDSS guidelines and quick fact sheets for easy reference.